My name is Sam Schiller. I am the Archivist and Collections Data Manager for the Denver Museum of Nature and Science. As archivist, I manage the museum's historic documents, including records going back over 120 years. I've been getting a lot of questions recently about comparisons between our COVID-19 epidemic and the deadly Spanish flu outbreak of 1918 and how that affected the museum at the time. It seemed interesting to meet someone from the time who could share what it was really like to live through the Spanish flu. So I tracked down Mrs. Clara Kearns of Leadville, Colorado, in the summer of 1919 as the third and final wave of the Spanish flu finally receded. Mrs. Kearns, can you hear me?
Oh my goodness. Oh my goodness. Oh my goodness. I'm so sorry. I'm so tardy. I'm so sorry. I was out with my little granddaughters and they have just been the light of my life. And ever since they were so sick with that flu, I just can't see enough of them. So forgive me, Mr. Schiller. It's a pleasure to see you.
Well, it's great to see you. Thanks for agreeing to join us today.
Oh, the pleasure's entirely mine. Thank you for the opportunity.
You are welcome. So first, some quick background on the Spanish flu. In March of 1918, about a year into the United States' involvement in World War I, a mysterious new form of influenza appeared in Fort Riley, Kansas. The flu did not last long, and the United States continued to send soldiers to Europe for the war. For a time, there was little development of the virus stateside. Now, during the spring and summer of 1918, the flu virus mutated in Europe and became stronger, affecting soldiers on both sides of the conflict. By August, that mutated version of the virus was beginning a second wave, much deadlier than the first, and soon made its way back across the ocean to the United States. Now, it's around that time that the Spanish flu got its name. We know the virus did not start in Spain, but the warring countries were censoring any mention of the illness to avoid giving hope to their enemies, whereas Spain remained neutral during that conflict and was freely reporting on it. So the flu became associated with Spain. So Denver's first confirmed case came in late September of 1918 from a University of Denver student just back from Chicago. And by October 6th, the city of Denver had already implemented restrictions to control the spread of flu. Now, Mrs. Kearns, I understand the flu showed up in your area around the same time. How did it feel when it appeared in Leadville? Can you tell us a bit about the effects it had on your family and how you dealt with it?
Oh, well, I certainly can, Mr. Schiller. As it so happens, it was around the 30th of September when a young man came back to Leadville after having been visiting a friend of his in the military camp in Washington. And right from that point, it went crazy. By the 6th of October, I think we had 20 cases. Things just snowballed right after that. And people were dying, sometimes as many as 12 and 15 a day. It was terrible. Everybody was so frightened. They'd been reading in the newspaper about this flu that was all over the country. And now here it comes to our little town. And it had everybody in quite a panic. Now, my own family, my daughter, Belle, she contracted this terrible disease, and so did her little girls, both of them, right in that picture, those two little girls. And she nursed them. She made sure they had good food, and she took good care of them, just like any mother would, and they made it through. Now, their father, George, he's delivering the mail up there in Leadville, so he comes in contact with everybody, so he wasn't able to come back home. He stayed with some friends, but my daughter and the girls came through it. But I don't know if you know the Obregons. They live next door to us there in Leadville. Good people and good friends, a big family, and we lost all of them to that terrible disease.
Wow. Well, thank you for sharing that. In 2020 with the coronavirus, most museum staff are working from home as I am now. In 1918, the museum was already dealing with a deficit of workforce since a significant number of the staff had left to contribute to the war effort. And when the Spanish flu shutdown occurred later that fall, we know staff used downtime to complete building maintenance and repairs. Mrs. Kearns, how did working people adapt in Leadville?
Well, I'll tell you. the mines were already depleted with their numbers, with good, strong men going to serve overseas in that war. So their numbers were down already. But this terrible disease hits, and people are dying, and there are not enough coffins. So there were people that were volunteering to make those. The mines that were telling people, you're working in the mines, but there aren't enough graves for people to be buried in. So if you would care to volunteer to dig graves, we will pay you, miners, what we would pay you to be working in the mines, and we'll hold your job for you for when you get back. Now, as I mentioned, people were getting sick just in droves, and the hospital was full. Nurses were at a shortage. So the city fathers decided to requisition that Clarendon Hotel right there on the main street of town because it had good heat. And they turned that into a hospital. And there are people like me that would have volunteered, but I couldn't be taking that disease home to Edward, and family people just couldn't be doing the work. So there were women that in that town that I had been disparaging of earlier, but they stood up, and those were the ladies that work in what they called the red light district. And those women went into that hotel and they tended those sick people, and some of them died as a result. Now, I would have done more, but what I could do was, ever since my son, John, his boy in Nebraska, signed up to be in that war, so I signed up to work for the Red Cross, and I still have my headgear that I worked with for that. And this is what it looked like when we were all working together. And I knit several pairs of stockings, but I knit all the time. But I knit stockings for the soldiers. I also was making food for people, as we all were, We were making food for people to eat. We were going to their houses, and we didn't go in, of course, but you knock on the door and you say, what can I bring for you? What can I bring for you? You get what they need, and then you leave it on the porch and you knock and you go away, and this is what happens. So that's some of the things that we were doing.
And Mrs. Kearns, what were you doing to treat your family?
Well, just like everybody, you'd be there and you'd make sure that everybody got good food. You'd make sure that everything was clean. That's about what you could do. And you'd make sure everybody was warm. You'd make sure they got out in the sunshine when they could. And they always sleep with the window open at night. You have to have fresh air. And you do common sense things like that. But there were people in town that were doing some strange things. Like if somebody was saying, oh, you need to take massive quantities of that aspirin. Well, I can say that a couple of aspirin makes your fever go down, but if you take too much of it, it's terrible for your digestive tract, And there was somebody that was selling people little sugar cubes soaked with kerosene to give to their families. Now, can you believe that? And one thing that was very popular was alcohol, which I don't hold with. And there is a prohibition in effect there in Leadville that the ladies of the church were very instrumental in getting that done. But you could get a special permit to do your bootlegging through the city council. And in November of the year 1918 of last year, that number of those permits went up to 2,000. Can you believe that? But the police had already confiscated some of the alcohol, and that got released so that the hospitals and the medical people could get what they need. I hope that all of that is probably over with by now. It can't be good.
Wow. Well, your story of sugar cubes soaked in kerosene is something else. I empathize, even today, misinformation abounds regarding treatments for our coronavirus, so that certainly resonates with me. Mm-hmm. So, we know that around or on November 11th of 1918, World War I ended with Armistice Day, and restrictions were lifted in many cities, Denver included, for those Armistice Day celebrations. Unfortunately, this resulted in a spike of new infections and a return of restrictions such as wearing masks. Fortunately, the spike was fairly short-lived, and restrictions in Denver were gradually lifted again through December of 1918. allowing the museum to reopen so people could once again enjoy the exhibits.
And now that you say that, the restrictions were lifted in Leadville in March of 1919. And, we waited for a while. Edward and I talked about it. We wanted to be safe. But after a little time went by, we were able to take not only Edward and myself, but Belle and those two little girls down to the museum in Denver, where I had visited in 1915. And it's just such a wonderful place. It was a reward for those girls for being so brave to get through. And I can't imagine a finer thing than to go to that museum. Can you?
Well, we look forward to that moment ourselves when we can return to the museum. Well, Mrs. Kearns, I want to thank you again for sharing some of your experiences with us today. And thanks to the viewers for joining us. I want everybody to stay safe, and we hope to see everyone again really soon. Take care.
Do take care.